We are now approximately 6 weeks from surgery, where we performed a resection of the lateral antebrachial cutaneous nerve that came across and gave sensation, painful sensation, to a previous operation, which was a tennis elbow release for lateral epicondylitis. And we performed a radial tunnel decompression, as well as a radial sensory nerve decompression and carpal tunnel. This patient was having symptoms of numbness, tingling, and loss of feeling in the first 3 fingers, as well as burning pain down the radial dorsal hand and severe pain in the lateral elbow, including the previous surgical scar that was performed elsewhere. Can you tell us about your symptoms and how long you had them, and a little bit about the previous procedures?
Well, I had my first surgery November 8th, and then they went back in and redid the surgery January 24th a second time. After the second surgery, I was in a cast from my top of my arm to my fingertips, and that cast, when they took it off, I had no sensation in my hand. My arm was all tight, pain in my elbow existed, so they wanted me to have an EMG done. The EMG showed that I needed to have the procedures that you performed. Since that, I still have no sensation in my arm, which you advised me will eventually go away.
Yeah, now this area is numb because we removed a couple of branches of a nerve that were stuck in this scar tissue. Is this scar painful anymore?
No.
No. And as a side effect of that, some of this area down here is numb as well, and this slowly will get better, though it will never be completely normal. But how is your pain in that area?
Pain in that area is completely better. There's no pain. I do have muscle spasms every once in a while, but that is, I believe, from, I really haven't had any kind of strength training or building in my arm since January. I mean, my last therapy session was back in December, prior to starting therapy with you.
Okay. And what about the burning pain that used to be present here and the numbness and tingling in your hand? Has that improved?
The numbness and tingling has gone away. The only discomfort I have now is just post-recovery from the surgery in my palm and right here at my wrist at the site of the incision.
Okay. Would you consider this surgery fairly successful then?
I would. Yes, sir.
All right. Knowing what you know now, would you repeat that operation if you had to?
I most definitely would.
Okay. Thank you.